Thank you. After all that fun to now hear about what we did all the First of all, welcome everyone. Our theme this year for our AGM is Together We Are Better. And sitting here under this tent on a windy afternoon, how do you feel together? Better? This phrase totally reflects the way we are. And we didn't spend a lot of consultation dollars to come up with this slogan, Together We Are Better. It just came naturally. It just reflects the way we work internally within the organization, whether we are helping families raise their children, assisting students succeed high schools, or helping people quit smoking. There's Wendy Kellen standing there, who does a lot of quit smoking programs and helping people deal with their diabetes. But it's about how we do it. It's not what we do only, but it's how we do it. And where who is in the driving seat, and then the driving seat is the community governance with the fantastic board of directors you've met right now, and the great staff that we have across the organization. So in this organization, whatever we do, it is done with that feeling of respect and dignity for each other and trust. And internally, across these 8 sites, 11 teams, how many? 9 sites? Okay, 9 sites, I'm stand corrected. Thank you. Whether it's North Kingston, that's where we started our roots, Better Beginnings, Street Health, Immigrant Services, Napanee, Pathways to Education, OHRDP, and I'm not missing anyone, am I? But all of these teams, whatever, serving unique population, but what brings us together is our shared vision, our shared mission of caring, responding, and building community. But it doesn't stop there. It continues how we work outside with our community members, partner agencies, be it with United Way and City on the poverty reduction table, be it with Board of Education and other folks on helping school children succeed, the cabinet for Pathways to Education. We can't do it alone. The issues that we're working on, the issues that are about marginalization, about pushing people out and not getting a sense of belonging, we can't work alone. It's not up to one organization or one person. It has to be done together. And that's why this phrase is so right for us, Together We Are Better. But just a quick snapshot. There's a lot of details in the annual report. I'm not going to go over the details. But we served last year over 8,800 clients, registered clients. We provided them with over 60,000 service encounters. And 94% of our clients would recommend our programs and services to others. And about the same number would claim that their quality of life is better because of the services provided to them. And on top of that, 92% of our staff say that their work is purposeful and rewarding. And I just want to stop here and recognize the work of our staff on the front line, the issues that they see on a day-to-day basis. Very high percentage of our clients have very complex problems. Over 40% live below, with a family household income below 25,000. Many complex, severe mental illness. The issues are many, and our staff on frontline deal with them on a day-to-day basis. Will you please join me in thanking them? There are a few significant achievements that I do want to highlight. First of all, where we are today, rising heights. We opened this place last October, and will you agree with me that this is revitalizing this community now. It has reconnected us with our roots where we started from, and I'm so proud today to be part of this area again. So Rising Heights, we started last year. You want to clap, Wendy? Go ahead. Though the economic environment has been very grim, but we were pleasantly surprised last year in August when I got a call on Friday afternoon that after years of groundwork, our capital grant for Napanee area CHC was finally approved, and we got a grant for up to building a building for up to $6.45 million. And about better beginnings. Last year, we also celebrated 20 years of working with families of young children in the Better Beginning catchment area. And I don't have the exact numbers, but I know that at any time, we reach out to about 400 families every year. So over the 20 years, you can count the number of families we must have touched. So thank you, BBKC staff, and all the fantastic volunteers. Many of them are sitting right here who make it happen. We also completed our first full year of providing dental health services. I'm so very proud of the dental health clinic, as I probably mentioned last year, that I was asked in my interview 12 years ago, Hersh, what are you going to do about dental health services? And as you know, it's not funded by OHIP. It's very difficult to make it part of our programs. But here we are as a result of the SMILES program, which is basically for children of low-income families, working families. And we got funded for two, not one, but two dental clinics. And one is all completely ready here, and we're also going to have dental clinic in Napanee. But what I want to highlight is that although the program was only for children of young families, but due to the generosity of people, dentists like Dr. Roy Chan, we are able to extend that care also to adults. And he is bringing the smiles to people who could not afford to smile. So thank you, Dr. Chan, wherever you are. And our immigrant services, which are helping many newcomer families make a better home in Kingston, they have done fantastic work. And under Scott Clerk's leadership, I can see Scott right there. The KIP program, which is sort of a part of ISCA, but sort of collaborative with KEDCO and Keys, has really developed fantastic relationships and partnerships, offering mentoring programs. Some of them are mentioned in the report, but last year, I believe it was last year, right, Scott? Kojiko approached the Immigrant Services and KIP program to do a new TV show called Diverse City. And it was, a small-scale program, but just found out that a month ago, this program was received the Star Awards honor, an award that is given for the best TV Kojiko programming from across Ontario. So in addition to that, our core services, our CHC programs across the 3 sites, I want to recognize all the clinical staff and their work. The 3 sites, North Kingston, Napanee, and Street Health, some of these sites participated in a provincial study carried out by ICES, and those who know, ICES stands for Institute for Clinical Evaluation Studies, and it showed that although KCHC probably sees some of the most complex clients in the whole province, our complexity, there is a measure, we call it SAMI. It wouldn't mean a lot, but it basically measures the level of complexity of due to medical conditions and We have clients who have more than 8 or 12 diagnoses, a very high number of them. But in spite of all of that, our overall, across the CHCs, our clients go to the emergency rooms less than what expected. That is a huge finding, that we are actually helping save the system a lot. So I do want to recognize the work of all clinical staff, again, doing what they do on everyday basis. Thank you so much. And there is more. We don't talk much about the OHRDP program, and that stands for Ontario Harm Reduction Distribution Program. And this program is a provincial program which basically supplies needle exchange and harm reduction supplies to needle exchange sites, to all sites across province. But this program stepped up to the call that was made to it to deal with the OxyContin challenge. You might have heard and read about it in the newspaper. There's lots of TV documentaries being made on how people have been made dependent on OxyContin, and it was being taken away, and there'll be lots of issues with the withdrawals. OHDP was asked to coordinate training and provide overdose prevention kits to all needle exchange and other partners who needed that across the province. And we were told that, and I don't have the details here in front of me, but I think we were informed about it in the first week of March, and we had to deliver and develop everything by end of March. And I want to recognize the work of Nadia, wherever she is, Durba, for her role in getting and coordinating the training sessions, and hundreds of people were reached through webinars. Thank you, Nadia. In the end, I also want to report that we reviewed our management structure last year. The organization has grown. We started with 7 staff in 1988, and here we are a complement of 150 staff. We started with 760,000 budget. We are around 14 million budget right now, and you can't do it alone in a flat structure. And we reviewed our management structure. We created a more efficient structure, more with clear reporting lines. As a result, we've developed a middle management team. And I want to recognize the work of this team. There's senior leadership and there's managers team. And it's incredible amount of pressure they have from both sides, and they are delivering on what we ask them. Thank you so much. Last but not least, I wouldn't be standing in front of you without the thoughtful leadership of my board. Thank you. Thank you very much for your guidance and your support, and asking me the difficult questions many times, but keeping me honest. And I thank you all, everyone over here. Thanks.